Hi, I'm Vinay Ketkar. I'm an orthopaedic physician working at the Royal Orthopaedic Hospital on the Back to Life program. And I'm going to talk to you today about making the most of medication. So the first question I often ask people is medication a good thing or a bad thing? And of course the answer is both. I'll talk to you a little bit about why the answer is both. So first of all, we'll start with medication in acute pain. So medically, what we mean by acute pain is pain that's been there less than a few months. And examples of this are things like post-operative pain from surgery, or if you've had an injury, if you've got a fracture or sprained an ankle. And in this type of pain, medication often works very well. And we know that because without medication, we wouldn't be able to do a lot of the surgical procedures that we do. Or if you have an acute injury, medication is often a good thing to use for a short time. But what about persistent pain, when pain has been there longer than a few months? As you've already learned from some of the other presentations, when pain persists, we know that there often isn't associated injury to tissues, that it's abnormal processing of those signals in the nervous system and the brain. That's what causes the persistent pain. So what we also find is that the medications that tend to work for acute pain don't tend to work so well. And this may be your experience. You may have, most of you who come to this program have tried medications of various kinds before. And you'll all have had different experiences, but often patients say to us that after a while the medicines they use don't seem to work as well. So I'll talk to you about various different types of medication, and we'll start off with the simplest kind, and where it can be useful and where it can possibly be harmful. So the simplest medications that you can use are things that you can rub in or massage in. These are usually gels or creams, and they normally have anti-inflammatory medications such as ibuprofen or Voltarol. Some of these you can purchase yourself, some of these you can get via prescription. And often these can help for a short time. And they can help because partly some of the effect is from the medication getting absorbed. Some of the effect is from the massage and the actual rubbing action, which can sometimes relieve pain in a particular area. The good thing about this type of treatment is that it doesn't tend to have many side effects. Unless you're having to use a huge volume of it, it doesn't tend to cause many side effects because it tends to be absorbed locally, and so you don't get the side effects that we worry about with some of the other drugs. The next type of medication we talk about is when we go into something taken by mouth. The commonest drug of this kind is paracetamol. Again, paracetamol can be useful short term, and it can actually give you pain relief when you're having flare-ups, for instance. Often people don't think paracetamol is very effective because it's available over the counter and there's a sort of perception that it isn't effective. But it doesn't tend to have many side effects, and some people do find it will help in the short term. The next type of medication which is often used are anti-inflammatory medications, and the commonest types of this medication that you may have tried are things like ibuprofen or naproxen. These are commonly prescribed in acute injuries again. So if you have an injury with inflammation or swelling, these are anti-inflammatory medications, and they tend to work very well for a short time. If you continue to use these drugs, the problem is that in most persistent pain, there isn't actually any inflammation going on. So if they do work, they tend to work just as painkillers, and they can be associated with side effects, some of which can become quite serious. The things that we worry about when you use things, anti-inflammatory drugs, non-steroidal anti-inflammatory drugs for a long time, are things like stomach irritation, stomach ulcers, and even bleeding from the digestive tract. If you find these medications are effective and you have to use them again during flare-ups, it's possible to have a separate tablet that can protect the stomach, and your GP can prescribe that. So if you do find that non-steroidals are effective for you, then it's a wise idea to use them for a short time, perhaps to manage flare-ups, and to have something to protect your stomach while you use them. From there, the other type of medication that's often prescribed are what we call opiates. Now, opiates vary from weak opiates, which are the type of codeine paracetamol preparations, such as cocodamol or codidromol. And then they go up to morphine itself or OxyContin, which are the stronger opiates. And in between, you've got drugs like tramadol. Now, the trouble with opiates is, again, in the short term, they can be very effective painkillers. But we know they don't work more than a month or two. And they have particular risks which are associated with them. One of the risks with opiates is tolerance. Tolerance means that after a while, you start needing more and more of the medication to have the same effect. And often people find they start off on a very low dose, and eventually they need higher and higher doses to give them the same benefit. The risk of that is that as you increase the dose, the side effects also increase. So you can get drowsiness, dizziness, you can fall as a result of the drowsiness, you can get memory problems, and also accidental overdose, which is a real risk. If you have to keep increasing the dose until you get effectiveness, there are reports of people accidentally taking too much of the drug. The other thing that happens with opiates is sometimes there is some evidence that they can actually cause sensitization, so that it can actually cause worsening of pain. So in the long run, being on opiates is not a very good idea. The final thing about opiates is addiction, which is what a lot of people are understandably concerned about, that if you actually keep taking the drug for a while, you almost start becoming dependent on the drug and you can't manage without it. And that is a risk of long-term use. So again, short-term use of these medications can be useful, but in the long term, we would advise against them. The last group of drugs is what we call neuropathic pain medications, and you may have encountered these. These medications usually have other uses. One of the drugs is amitriptyline. Amitriptyline was originally discovered and can still be used for depression. The doses used are very different. For instance, to treat depression, we often use 70 to 100 milligrams. But to treat persistent pain, we start off with 10 milligrams. Even at that dose, often people find that the next morning when they wake up, they feel significantly drowsy. This will often wear off if you continue for a few nights. And we advise, if you do use amitriptyline, to use it at night. Amitriptyline can be useful in persistent pain because often people with persistent pain have sleep disturbance. And we know that when you don't sleep properly, this will wind up the pain system, and otherwise it will amplify pain signals. And if you are finding that your sleep is regularly disturbed and you're not feeling refreshed in the morning, which is again commonly reported by patients with persistent pain, then a small dose of amitriptyline at night can have the dual effect. It can help you sleep at night, make you feel more refreshed in the morning, and it can also help you, we know that it will also turn down pain signals. You may need to increase the dose with the supervision of your GP, so you may start off on 10 milligrams and you may work up the dose slowly over the weeks. But that can be a useful thing. If you find that despite persisting with it, that you're still getting drowsiness in the mornings, then there is another variation of the medicine called nortriptyline, and this often causes less morning drowsiness, but can still have effects on reducing pain. So amitriptyline and nortriptyline can be useful in persistent pain. The other thing to remember with these medications, particularly with amitriptyline, is that the sleep benefit starts very early, but in terms of reducing pain, it can take up to 6 weeks to have effect. And often people aren't told that or aren't aware of that, and they give up on the medication very early. So I often see patients who've used amitriptyline for a week or two and give up because they find that it's not having any effect. So if you do use something like that, you would need to use it for about 4 to 6 weeks to see if it was of any benefit to you. The other medications that are often used in the neuropathic pain medication category are gabapentin and pregabalin. Now, these drugs were originally discovered as anti-epileptics to stop people having fits. And they are licensed for what we call neuropathic pain, or pain from nerves. Now, they can be effective in conditions such as diabetic nerve damage, where you've got people with diabetic neuropathy, or people with pain after shingles. But in persistent back pain, we don't find that they are particularly beneficial. And in fact, I think current guidelines don't recommend that we use these drugs in persistent back pain, because we know that, again, the back pain is more complex. It's not coming from damage to a nerve. And again, our experience, and my particular experience, is that we find that people on these medications often don't get any benefit, and again have to keep increasing the dose. They often have side effects from the drugs as well, such as drowsiness or weight gain, dizziness, feeling sort of spaced out. And so we often try and help people to come off these drugs, and they find that they're no different coming off them. They can have a withdrawal reaction when they come off these drugs, and sometimes the withdrawal reaction causes an increase in pain, and that can make you think that the drug is actually effective. So, for instance, if you start reducing the dose and your pain worsens, you think that the drug was doing something. But often that isn't the case. Often that is just a withdrawal effect with these medications. So again, with these medications, we don't recommend that you use them long term. So where are medications useful? I've talked a lot about the possible side effects and why medications aren't useful long term. They can be useful in flare-up management. So medicines such as paracetamol, or the non-steroidal anti-inflammatory medications, or even a low dose of opiates such as cocodamol or codidromol, can be effective during a flare-up. Now, as part of managing flare-ups on this program, we will teach you other things to manage flare-ups first. So there are things like taking yourself out of a stressful environment, maybe getting some, maybe allowing your body to rest for a day or two. Breathing techniques such as the 7-11 breathing or some of the mindfulness techniques, these are also useful things to try during a flare-up. But if you find during a flare-up that these things are not working and you need some additional help, then medication can be useful short-term. And also, some people say to us that they have flare-ups at times when they really need to do something very important in their life. So if that's the case, then using medication can be useful. And it's often effective if used short-term. But long-term medication in general in persistent pain we find is not effective. And the science is seeming to back that up. And that's why we tend to advise against that use.